Hello, everyone, and welcome to the first lecture of Advanced Pathophysiology, the cell. The reason why I chose this to be the first lecture of the course is that the cell is the basic functional unit of the human being, and also it is where all diseases start. Any disease starts by some sort of cell damage or cell injury. Let me take, for example, type 2 diabetes. Where is the problem in type 2 diabetes? The problem actually is in the tissue resistance to insulin. So cells and tissues become resistant to insulin, and they do not follow insulin instructions, and they do not allow glucose inside the cells to be utilized in energy production. So glucose accumulates outside the cells, leading to hyperglycemia and the sequelae of hyperglycemia in type 2 diabetes. Heart failure. Heart failure is a condition that starts in the cells of the myocardium, the muscle of the heart. These cells will, for some reasons, will change their shape, a condition that we call cardiac remodeling or hypertrophy, and these cells will acquire abnormal shape that worsens the function, and the heart cannot provide adequate cardiac output, which is the definition of heart failure, and so on and so forth. So we are going to start talking about the cell. The cell, as I mentioned, this is the basic structural and functional unit of the human being, and the activity of an organism depends on the activities of the cells, and the cell is the unit. Groups of cells will form a tissue, and tissues will make organs. Organs will be parts of different body systems, and this is the human body. Each cell is theoretically capable of doing all of these 8 functions. Like, for example, when I graduated from med school, that was a long time ago. I will not tell you how long, but I was ready to do any specialty in medicine, any specialty. I was ready to do peds, surgery, OBGYN, whatever. And then I started residency in anesthesia, and I became specialized in anesthesiology and intensive care. So I forgot about some stuff. I forgot about OBGYN, for example. So some cells, some tissues also forgot about OBGYN. Some tissues forgot about reproduction. Some tissues have become so specialized in what they do that they no longer are able to reproduce. And these are 3 types of tissues in the human body: the brain tissue, the neurons, the cardiac tissue, the cardiac muscle, the myocardium, and the skeletal tissue. These 3 types of tissues do not do reproduction, They are specialized in what they do that they forgot how to reproduce. They forgot OBGYN. Remember this because we're going to need it in a few minutes. So any disease starts by some sort of cell damage or cell injury. And when the cell is injured, the cell is not going to surrender easily. The cell will sing, I will survive, and the cell will try to adapt. And while the cells are adapting, actually, the tissue struggles. And this tissue struggle will result in the signs and symptoms of the disease. So we develop signs and symptoms of any disease, not because our cells died because of the disease, but because our cells are resisting, our cells are fighting back, our cells are adapting. So you get the signs and symptoms. And we say that you are kind of compensating and you are trying to recover. But there is a fine line. Once the cells or the injury crosses this fine line, and once the cell fails, then the whole tissue will fail Consequently, the organ and the system will fail, and eventually the organism will die. So this is the disease process, the summary of the disease process everywhere. So what are the types of cell injury? What can injure the cell in the human body? The most common type of cellular injury is the hypoxia secondary to ischemia. Ischemia is decreased blood supply to the cell or to a tissue. And because the blood carries oxygen, so if there is decreased blood supply to one tissue, this tissue is going to suffer from hypoxia. And this is the most common type of cellular injury in the human body. Other types of cellular injury are chemical injury by drugs or mineral toxicity, physical injury, whether mechanical, thermal, electrical, radiation injury, like by ultraviolet rays, as in sunburn, biologic injury, the different infections, bacterial, viral, fungal, genetic injury, if you inherit a bad gene, if you inherit a gene with a mutation, this is some sort of genetic injury, and nutritional injury, vitamin deficiencies. All these are types of cellular injury. And again, once the cell is subject to any type of injury, the cell will try to adapt. And a minor type of injury is called stressor. So exercise is kind of a physiologic stressor. So even with exercise, the cells, because they are somehow stressed, so they will try to adapt. But sometimes pathological stressors, we describe them as injuries. So injuries are kind of very severe stress on the cell due to pathological reasons. If the cell fails to adapt, the cell is going to die by either necrosis or apoptosis, as we're going to discuss later. So this diagram summarizes what I have been discussing. A normal cell lives in a state of homeostasis, balanced state. And once a normal cell is either subject to stress, which is most of the time physiologic, or injury, which is most of the time pathologic, the cell will try to adapt by any one of these 5 adaptation mechanisms that we are going to discuss in a minute. If, while the cells are adapting, if the cells manage to recover and the injury is mild and transient, then we call it is a reversible injury, and this adaptation is going to take the cell back to its normal state or homeostasis. Whereas if adaptation fails and the injury is severe and or progressive, then the injury becomes irreversible and the cell is going to die. And as I mentioned, there are 2 types of cellular death, necrosis or apoptosis. So now let's start talking about the different types of cellular adaptation. If we look at this upper row and we consider it the normal nature, the normal cells. Now look at this row. These cells, compare them to the normal cells. What do they look like? Simply, we can say that they look smaller than the normal tissue. Now, there are 2 words for cells getting smaller. We either describe this as atrophy or we describe this as shrinkage. So what's the difference between atrophy and shrinkage? Atrophy is when the cell decreases in size due to loss of actual cellular matter, due to loss of lipoprotein. Whereas shrinkage means the cell decreases in size due to loss of water. So atrophy is one type of cellular adaptation. If we look to this row, cells here appear bigger than the normal state. Again, there are 2 words for bigger, either hypertrophy or edematous, or swelling. So what's the difference between hypertrophy and swelling? It is the nature why the cells are getting bigger. If the cells are getting bigger because they accumulate too much water, that's a swelling. But if cells get bigger because of accumulation of actual cell matter. That's hypertrophy. The third method of adaptation is here. These cells look normal, but they only are too many. There are too many of them because these cells adapt to stress or injury by increase in number, by proliferation. And now it's the time to remember what are the three types of tissues that cannot adapt by hyperplasia. Yes, these are the three tissues that forgot OBGYN. These are the brain tissue, the cardiac tissue, and the skeletal muscles. They cannot adapt by increase in cell number because they do not reproduce. If we look at this metaplasia row, and we try to compare these cells with normal cells, it's like comparing oranges to apples because they seem to be two different types of cells. Yes, and this is the way of adaptation. Meta means different, plasia means shape. So sometimes the tissues adapt by converting to a different shape. It's what I prefer to describe as a new look, a new look. This even happens in human beings. Sometimes when you are stressed, you go and get a new look, you cut your hair or whatever, you get a new look to cope with this stress. And the last mechanism of cellular adaptation, dysplasia. Dysplasia, aka atypical hyperplasia. Here, it's not only a different type of cell, but here we have deranged cellular growth, different sizes, different shapes, different organization, or not very well organized cells. And this dysplasia is the worst type of adaptation, and it is in many cases precancerous. So now let's take some examples of these 5 different mechanisms of adaptation. Atrophy. Disuse atrophy. If you put your leg in a cast for 6 or 8 weeks and you're not moving your calf muscles, when you remove the cast, you will notice that your calf muscles are atrophied. That's what we call disuse atrophy. Atrophy of the female reproductive tract after menopause due to the loss of the support of estrogen. That's another type of, that's a hormonal injury, and cells adapt to it by atrophy. And when these cells get smaller in size, the lady will start to experience some signs and symptoms like painful sex, what we call dyspareunia. Denervation atrophy, patients with compression of the median nerve here at the flexor retinaculum, what we call the carpal tunnel syndrome. If it is so much prolonged, you get atrophy of the thenar eminence muscles. Inadequate nutrition leads to atrophy of tissues. Ischemia leads to atrophy of tissues as well. Hypertrophy, the increase in cell size. Cells adapt to physiologic stress by hypertrophy. Like, for example, the uterine cells in pregnancy, they get bigger in size. By the way, in pregnancy, the uterine cells get bigger and get more in number. So the methods of adaptation in pregnancy are hypertrophy and hyperplasia. This is how the uterus adapts to this physiologic stress of having a baby inside. Also, muscle exercise. This guy probably spends like hours and hours in the gym, building up his muscles. There is one similarity between me and this guy. Both of us have the same number of skeletal muscle cells. He does not have more cells, more skeletal muscle cells than I have. The only difference is his muscle cells got much bigger because of exercise. A very important example of pathologic hypertrophy is what occurs in the myocardium, the cardiac muscle, in patients with hypertension. In patients with hypertension, the left ventricle is 24/7 working out. is doing push-ups. It's trying to push blood against the resistance of the high blood pressure in arteries. So 24/7, the left ventricle is working out, working out, working out. So what is going to happen? The left ventricle will try to adapt with this pathologic stress or with this injury that is caused by the very high blood pressure and the increased vascular resistance. As a result of that, the cells of the left ventricle get bigger and bigger and bigger. And look at the wall of the left ventricle, it becomes very thick and stiff. And as a sequelae of that, the cavity of the left ventricle becomes small, and the left ventricle cannot fill with enough amount of blood, so it cannot pump enough amount of blood, and that's hypertensive cardiac disease that leads to heart failure in these patients. So myocardial hypertrophy is one example of pathologic or abnormal response to the increase in blood pressure. Another term for this hypertrophy, when it occurs in the left ventricle, we call it cardiac remodeling. Cardiac remodeling. Hyperplasia, the increase in cell number. Physiologic hyperplasia as a compensation, like in the hands of any worker, manual worker, the skin of the hand is thicker. Regeneration of liver cells after injury occurs by hyperplasia. Wound healing occurs by proliferation of tissues around the wound. Pathologic hyperplasia is noticed in the endometrium when there is excessive or abnormal menstrual bleeding. BPH, benign prostatic hyperplasia, in older men, that's an androgen effect, and the skin warts produced by certain viruses. These are types of pathologic hyperplasia. Now let's come to an interesting example of adaptation, metaplasia. Metaplasia is what I like to call the new look. The new look. When you are stressed, you try to get a new look. When tissues are stressed or injured, they get a new look. Metaplasia is the reversible replacement of one cell by another cell type. One type of tissue changes to another type. And let's talk about an important example of metaplasia, which is bronchial metaplasia in smokers. So let me use the whiteboard to explain this. So this is the lungs, the trachea, the right and left main bronchi, and then the bronchi. If we take a cross section of the bronchus here, what is the type of cells that line the bronchial cavity? These cells. What is the type of cells here? The type of cells here is a very fancy type of epithelium. It is columnar epithelium. That's the normal tissue that lines our bronchi, the columnar epithelium. And it comes with a luxury option, which is the cilia. And this is an expensive tissue. Why do I say it's expensive tissue? Because it needs a lot of energy. It needs a lot of ATP. So this ciliated columnar epithelium is a fancy, expensive tissue. And the cilia functions to get out any dust or whatever, it clears your airway passages continuously. So when this fancy, expensive type of epithelium is subject to injury, and the injury here is by smoking. So when this guy smokes and you get this damaging effect of smoke, when you subject your bronchi to this smoke, this is injury. This is injury. Now, the body cannot afford to cover the bronchial mucosa by this expensive type of tissue. It reminds me like when I graduated from med school and got specialized in anesthesia. That was back in Egypt, and I practiced anesthesia, and actually anesthesiologists make good money anywhere. Even back in Egypt, I claim I made good money because I worked as professor in the med school, and also I had my private work, so I made good money. So back then, because I made good money, I could dress up in expensive, fancy suits because I had enough money. Then when I moved to the States and I joined and I started teaching rather than practicing, yes, thank God I enjoy it, but I cannot deny that it is severe financial injury. So now I cannot afford to get the same fancy stuff that I used to get while I was practicing anesthesia. And now I just go to maybe Walmart and go to the clearance racks and just pull out cheap type of clothes. This is what happens when the bronchial mucosa is subject to smoking. Now the body is gonna shift to the cheapest type of epithelium to utilize it as bronchial epithelium. And this is the cheapest type of epithelium. It is the epithelium that covers the skin. Look at the cells. They are not columnar cells. These cells look like scales arranged in layers. So we call this type of tissue, we call it stratified, because the cells are arranged in strata or layers. Stratified squamous, because the cells look like scales. Stratified squamous epithelium. And where are the cilia? The cilia, are you kidding? I'm teaching now, I'm not practicing. I'm smoking. So there is no cilia because cilia is expensive. Cilia need ATP, needs energy. But this type of tissue is cheap tissue. It does not need any energy. So it does not come with cilia. Cilia only is a luxury option. So actually smokers, because they do not have cilia because of this metaplasia, and notice that metaplasia is reversible. So we're gonna talk about this in a minute. So this type of adaptation is called metaplasia. It's the change of one type of epithelium under the effect of any injury or stress to another type of epithelium. And smokers, because their bronchi do not have cilia, so they have to clear their bronchi themselves. So they wake up every morning and they start to cough to clear up their bronchi. The good news is metaplasia is reversible. So if you stop smoking, in 6 to 8 weeks, you return back to the normal type of epithelium, you get your cilia back, and everything is perfect. But the bad news is, if you don't stop smoking at one point of time, no one knows when, maybe after a year, maybe after 2 years, maybe after 10, 20 years, maybe never, this metaplasia can change to the bad type of dysplasia, And dysplasia is precancerous, so it can take you to cancer. And this is the reason why the best advice you can give to your patient who smokes, stop smoking right away. Stop smoking right away, because at one point of time, this normal adaptation, this good type of adaptation, can become the bad type of adaptation, the precancerous type of adaptation, and you develop lung cancer because of this smoking. So let me get back to the PowerPoint. Another example of metaplasia is Barrett esophagus. In patients with GERD, gastroesophageal reflux disease, due to the exposure of the esophageal lining to the gastric acid because of this regurgitation, because of the leaky, lower esophageal sphincter, the cells of the esophagus again change to a different type of epithelium. So normally the esophagus is lined with squamous epithelial cells, and they change to columnar epithelium. We call this Barrett esophagus. We call it Barrett esophagus. Now, the last and the worst type of adaptation is dysplasia. Dysplasia is deranged cell growth of specific tissue. And the resulting cells will vary in size, shape, and organization. It's a total mess. It's total mess. I think I have a picture for it here. Yes. So look at this. This is metaplasia. Look at the cells. Yes, they are different from the normal ciliated epithelium, but still the cells look organized, the cells look neat, and they are kind of similar in size and shape. But look here at dysplasia. It's a total chaos. Cells vary in size and shape. And look at this. Some cells even have 2 nuclei inside. That's bad. That's bad. That's disorganized. So some tissues adapt by dysplasia. And sometimes this dysplasia complicates metaplasia when the injury is persistent and or severe. And this dysplasia is, the next stop will be cancer. The next stop will be cancer. So dysplasia actually is a bad type of adaptation. It occurs in the epithelial tissue of the respiratory tract if patients do not stop smoking, and also in the epithelial tissue of the uterine cervix under the effect of HPV, human papillomavirus. And this is the reason why we should do pap smear annually for ladies to check for this type of dysplasia. And this dysplasia, it occurs in grades. So it can be very, very, very mild. So we say this is a low-grade dysplasia, which means it's bad, but not too bad. But when you have high-grade dysplasia, high-grade means it has been there for quite some time, so that the cells are really messed up, and they vary in size, shape, and organization. And this high-grade dysplasia is, of course, much worse than the low-grade dysplasia, because high-grade dysplasia is going to take you right away to cancer of the cervix. And once you detect this bad type of dysplasia, you have to take this part of the cervix out surgically in order to protect against cervical cancer. Dysplasia is potentially only reversible, but most of the time it is irreversible. Most of the time is irreversible. And this ends this segment on cellular adaptation. In the coming segment, we're gonna talk about cellular injury, the manifestations and mechanisms of cellular injury.